Hello, good evening, and welcome back. Revealed, health tourists cost the NHS £150 million in unpaid bills, as doctors say asking for payment is racist, and hospital chases Nigerian mother for £500,000 over birth of her quadruplets 3 years ago. It does change between quadruplets and triplets, but I believe it's quadruplets. And when they say doctors, it's the doctors' leaders. Okay. Cash could pay for 6,000 nurses, 22,000 heart bypasses, or 5,500 junior doctors. 2 London hospitals are owed £56 million, including almost 400,000 for one patient who is Nigerian Priscilla, 43, racked up bill by giving birth to triplets in West London. But I believe it's quadruplets, 2 of whom were premature and they died. The other 2 survived after a lot of postnatal care, which is largely responsible for the cost. So they don't say, there are a few things with issue here, although it's easy to say, yes, here we go, this is why we need firm borders, we need to enforce the laws, and you need to stop being worried about what's racist and what isn't. But I think this would then show at least that is where the culture and society is at the moment, whereby we're so concerned about not being racist that it does idolise and put on a pedestal ethnic minorities, if you will. They are the privileged minority. They have become the elites, as far as I'm concerned. But it's worth mentioning that although they put these numbers here for nurses and junior doctors, they don't say how long it took for this £150 million to be accrued. And also you might be wondering, well, that's quite a lot of money, but what is the national budget for the NHS, for example? So if we look up that, for healthcare, it comes out to £152.9 billion the fiscal year. So that means the money missing is 0.1% of the annual budget. So, put that way, it's really not that much when it's 0.1%. And, that's why I'm annoyed about misleading things like that. But they are saying overseas patients are a problem, and there could be more, because there are 60 hospitals that haven't mentioned how much money that they're owed. So still, if you put it up to 1%, if you could make that money back somewhere else, although you definitely should here. I'm sure there are other problems that they're facing, and it's not just the NHS, because at least with something like this, as small as it is in comparison, just being 0.1%, that there is then the thought that, well, if this is happening here, then what else is happening? If you cut the fat, plug the gaps everywhere, then those small differences will make a large difference. I mean, so as Tesco says, every little helps, if you will. And I know the British cycling team had that mentality as well, that we do every little thing, changing the helmets, the lycra, the width of the tyres, the bikes, anything like that, just to make a few fractions of a second quicker, and then in the end, it does make enough to win. So they're saying that there are different hospitals on different amounts. One is owed £28.3 million, and so they say total responses from 91 hospital trusts, but another 60 have not provided the details. In addition, the figures only account for those patients flagged up as an overseas visitor who were charged for their care. Many others have had free treatment as staff presumed they were UK residents or chose to turn a blind eye as part of a new drive from within the service. And this is also one of the things that... Oh, God. Is that a rainbow flag? Okay, make things political, why not? But that is one of the things that this points out, that you cannot have open borders if you're going for a social welfare state, as has been pointed out many times before, and I'm in full agreement with it, that if you want open borders, then you can't have social healthcare. So here they have some more numbers here. They're saying what the £150 million could pay for. These numbers are all, take with a grain of salt. At least they do say at starting salary, for example. And then these other numbers, I'm surprised they can be so precise, considering every procedure is going to be slightly different, which is why people need to be paid so much, because of the complications involved. The jobs still require high IQ, like doctors, lawyers, pilots. IQ is a way to determine how quickly somebody can react to fast-changing situations. And you need somebody who can react quickly to a fast-changing situation in a scenario like what we got here, delivering a baby through normal labour, because there are a plethora of things that could go wrong. And if you don't know how to fix it in that instant, then you could have a death on your hands. And of course, that's what we're trying to avoid. Alright, so moving on. Philip Holborn, Tory MP for Kettering, said well-paid NHS bosses who failed to charge visitors for using a health service should have action taken against them. Yep, and people in the comments of this article are also saying just charge them out of their own salaries if they let them get away with it. or some said just 10%, anything like that. Hit them in the money. that's it's normally where it hurts. But yes, I'm against NHS anyway, because at least then you would know if you decided to be with a private insurer, it's like, well, it's only people paying in who are going to get this healthcare, or if I'm paying into one that has outreach and decides to have charity or donation, then it's going to help those other people. You could, of course, do it the more old-fashioned way if you have a cohesive community, at which point everybody within the community takes care of each other, and then they also have a character assessment of you to know that if you're in hard times and need help, need financial support, that they know you're going to spend it wisely and you're not going to screw yourself over and waste their money. The same thing then if somebody has an illness and is trying to get back to health, donations like this also work. I'm sure you know the cliche of passing around a collection bucket at churches in order to help somebody who's recently had a tragedy befall them. And crowdfunding, which has now become online, is also a fine example of that, and how effective it is when somebody hears that there was a problem with somebody that they know of, they have an understanding of their character, they then decide to donate the money. So it's the same thing here, and that's how charity works, but it's just on a more personal level. So that's what I would say. That then also encourages people to be nice to each other, because they don't know when they're going to need to call upon that friendship in order to help them out. And also, people talk to people, at which point your reputation will be carried around, and then other people will know about you and whether or not they wish to support you. So, moving forward, they say all NHS trusts must charge overseas visitors for their care they receive unless an exemption applies, and to rigorously pursue any outstanding bills. We've made good progress in the last few years with £1.3 billion recovered. So who knows how much is really owed then. At least then we're getting to 1%, which is good. And he was saying premature triplets cost the NHS 500,000. Lady, this is great. She had intended to fly to Chicago to have a baby, but was turned away by US officials who claimed she would be unable to afford their healthcare costs. And in that situation, what do you want to do? Do you want to say, well, you're poor, you can't afford it, so leave? Or do you think this is where a social safety net comes in, even if they're from a different country? Or do you think this is just where charities come in? I'm intrigued to know what you guys have to say below. I'm all for charities, personally. And then it says here that it's 4 babies instead. 2 died shortly afterwards because they were so premature. The other 2 spent weeks in the hospital's neonatal intensive care ward. And her current whereabouts are unknown. But do you really think she's going to be able to afford the 500,000? And then what do? You don't have debtors prison anyway. And then if they escape the country, then you can't prosecute them in another country because they're outside of your area. So there's nothing you can do. But yes, charge everybody individually, have insurance for them. I would strongly suggest that. Have a community, take care of the people around you. That's my advice to everybody watching this. Take care of everybody around you, but remember that you can do what's best for you. You can be selfish in your own pursuits for the betterment of yourself, and that will help out the people around you. If you do what's best for you, it will be what's best for other people as well. So believe in yourself and achieve. But that's it. That's all for me. Let me know what you guys think, and I will see you next time. Have a good one.